Hello and welcome back. This is episode 2 of Your Sexual Health, Your Power. I remain your favorite host, Uchenna Amadi, and I am with the incredible Dr. Emeka Igbodike and Mrs. Unyime Etura. In episode 1, we explored why sexual health is your power. And trust me, my mind is still processing some of the punchlines that they have dropped here. Because tell me why somebody will pop 2 pills of augmentin and say they are now good to go. Doctor said the person will be going for rampage now. Please, that is not best practice, please. But I'm glad we're having this conversation so that we can all be enlightened. Now, moving into episode 2, I still want to start with Doctor, and I'm going to be asking him, why are STIs often called silent infections?
Okay, thank you for that question. You see, the key word there is silent. And usually we know that when anybody is silent, you're not saying anything. And it's still on the background of asymptomatology. That is, there is no symptom at all. And that makes it a little bit tricky because if an individual is infected and there are no symptoms at all, so the individual will feel, I'm good. And because of I'm good, that means that the transmission rate becomes very high. And of course, asymptomatology does not necessarily mean that the person cannot transmit it to another person. So again, at the center point is safer sex. So whether there are symptoms, whether there are no symptoms, it is important to stress the importance of safer sex assault, which we defined in the last episode. Abilities to, prevent pregnancy when they are not wanted, and of course to prevent sexually transmitted infections. So silent is because there are no symptoms.
Okay. So what are the dangers of leaving the STIs untreated or undiagnosed, being that they are silent?
Okay, so let's try and mention a few of them. There are quite a number of them, syphilis, chlamydia, gonorrhea infections, and of course the trichomoniasis. Yes, that's caused by Trichomonas vaginalis. All right, so I want to single-handedly pick out the chlamydia infection. Now, chlamydia is so terrible because it's one of the center points. In fact, it's one of the culprits of tubal infections that will lead to tubal infertility in females, which account for up to 60 to 70%, especially in Nigeria. So now, chlamydia infection left untreated can lead to what we call a smoldering effect in the fallopian tube. That is the cilia. The tubes has something that looks like how do we put it now in layman terminology? Hair-like, and they are constantly moving.
Therefore,
Yes, that is what pulls the egg and pick it where it gets fertilized and so on. So what chlamydia will do is that it will smoothen it. It becomes like a paper. Yeah. So the individual with chlamydia infection, we now have risk of having maybe ectopic pregnancy. So peradventure, the eggs will come and the embryo is fertilized. It cannot even waft it it just gets stuck there and all that.
It starts developing.
Yes. Then the issue of gonorrhea infection, it can also cause dubar diseases. It can cause disease, ophiritis, ascending infection all the way. In fact, the whole reproductive system of the woman and of the man too. Because, and of course, when you leave them for a very long time, we'll look at the males, they can lead to what we call, they can cause inflammation, and they can actually look and occlude so we have what we call people having issues with maybe they want to release semen. It cannot pass anymore because there's already an occlusion at that point.
What do you mean by
occlusion? So blockage. I'm using the word, it said we should avoid medical terminologies and all that.
Please
so
break
stenosis.
It down further.
So, so those areas, those pathways whereby you have movement of the semen, it has to have from where it is stored, it comes to the penis and is ejaculated. All those areas, the tract can actually be obliterated. It becomes a problem. You understand? It can even cause, even where urine is coming from. You understand? The urinary tract infection, it can also cause a problem there and cause occlusion. You have somebody having issues with urination, having pain, what we call dysuria. Usually start with that. Usually one of the signs where people have gonorrhea infection is that they have pus in their coming out from the penile shaft. From there they have pain when they are urinating. These are issues, and over time, if left untreated, they can cause occlusion with in those pathways and all that, and so many other issues. Some people can have joint issues, what we call arthritis, and all that. So when they leave these things untreated, it can cause all sorts of problems. Even syphilis. Syphilis can, remember that when we're talking about partners, we should also look at transmission from mother to child. So there is also what we call MTCT, mother to child transmission. So they can, transmit this, like, for instance, the gonorrhea can affect the eye of the child.
The baby.
Yes, or the baby, causing ophtalmitis, and the syphilis over time can even start affecting the brain and all that. So
and this is from as in not treating a silent infection.
Yeah. So you can see that I'm just speaking also because of time. These are issues, and now when they are silent, they don't show anything. Over time, they might begin to show, but at that point, they are starting to show some symptoms. They have already started causing damages.
Damages, yeah.
You understand? So the individual did not know about this. He's just moving around. There is not just that. The problem is not that it's not just that it's only the person. You are also sharing it among other people. And the other people are sharing among other people. You understand?
Those what they call them silent carriers. As they are carriers, they are not showing signs, symptoms. They are busy disseminating it. That's why there's this thing back when we were in school. They used to say HIV, they show for face.
They show for face. I was about to shout it.
They show for face. So you not just look at someone and say, okay, I saw rashes or I saw this. By the time it gets to being symptomatic, that means it's already bad. Following what Doc said, another should I call it? Although it's also still in the class of STI, the hepatitis.
Yeah, sure.
That
hepatitis
comes to mind, hepatitis B. Hepatitis B, most of the symptoms for hepatitis B actually masks itself as malaria symptoms because it affects the same organ, that's liver. You hear someone saying, "Oh, I had fever, I had malaria, but I treated it 2 months ago. Why am I feeling sick again?" When I hear people saying such, I'm like, why have you checked hepatitis B? I know several, in my line of duty, I know several people have advised. I'm like, okay, why you're doing the malaria test again? Why not do hepatitis B? And it came out positive.
Wow.
Seriously. Wow. So I've seen very healthy people looking all tush, all glammy,
you read my mind,
all body looking, and they are carriers.
Yeah.
Now, this begs the question, how common are STIs among the healthy-looking individuals? How common? Like between you and I now, that we are claiming we are very healthy. We are healthy.
Yeah, so
how common?
Yeah, well, we when we talk about how common, we are now talking about epidemiology and statistics. Yeah. And it's always good for us to quote a very central body, which is at this point we'll talk about World Health Organization. They had a statistic they had in 2020 and another one in 2022. And we are looking at some organisms, the key ones that we mentioned earlier, the syphilis, the chlamydia, the gonorrhea infection, and of course, so when they look at all this, they discover that about 274 million individuals have new infections in 2020. 274, million. That's a lot. And in this 200, they were now saying that about 1 million was almost, we are looking at each time, that, periodically, you have this globally in the whole year, but every month you have about 1 million new infections, Then in 2022, they discovered that about 700,000 exactly of new infections can actually occur in the newborn. What we call congenital syphilis. So when you look at all these statistics, it will tell you how the burden of this disease each time we talk about it.
That's a lot.
Some people say, don't worry, all these things are just myths. It's not true. They exist.
This cannot be myth.
And they are all sexually transmitted. And it's just for people to be very careful out there. about all this. So it's pretty common.
Amongst the healthy
Yes,
people.
among the healthy, yes.
Let me stay on you a bit, Doc. Routine testing. I know you talked about it in the last episode, but can you reiterate? How can routine testing help prevent long-term complications like infertility or chronic illnesses?
Okay, thank you. So, sexual health is very big. So we will just pick few. Otherwise, we will not be organized, all right?
Yeah.
So, how do, in terms of, you said prevention, right?
Yeah.
How
can it prevent long-term complications like infertility or chronic illnesses?
Yeah. So now it is all about the issue of screening. We mentioned the reproductive age is defined between ages 15 to 49 years, according to WHO.
15?
Yes, 15 years to 49.
It's not 18 again?
No, 15
wow.
to 49.
Since they occur.
Some authorities will say 15 to 44. But what is common, according to World Health, is 15 to 49 years. So now the question is this: how do you prevent this? First of all, is education. You see, awareness, as simple as it sounds, information is indeed power. When an individual knows that if I am abstinent, I told people, I said, one of the best ways of preventing this is being abstinent until you're married. Okay, all right. But we know.
Okay, all right.
We said that when some people may not necessarily be that, so we're not talking about being responsible about your health. So the first thing is information. What are these diseases? When people don't know that there is HIV out there, they don't know there is chlamydia, they don't know there is syphilis, they don't know there is gonorrhea infection. So they wouldn't be proactive about even trying to check. Then secondly is still on that same information is about preventive stuff. Be responsible about your sexual escapades. Knowing, like we have mentioned, the issue of silent diseases, that they don't show, they don't give you anything. So you just that. Being responsible, in alcohol, they say if you are 18, you drink responsibly. So we can say if you are we say 18 now, see they're saying 15 to 49. So if you are thinking about sexual intimacy, be responsible about it. Be responsible and that, because few minutes of pleasure can lead you into a lot of sorrow. All right?
A lifelong
stuff.
Punchline. Please repeat it again.
Yeah, so I said that few minutes of pleasure can land you into a lifelong sorrow. And you see somebody running from pillar to post because both tubes are blocked. They're not telling you about IVF. You know how much IVF is today,
And you may not even be successful after spending that amount.
You understand? Then the issue of screening, like we talked about the issue of hepatitis B. When you do some of this, we have made it is compulsory for pregnant women. So some women that are pregnant, definitely we have it as a package to do hepatitis B screening as part of antenatal care. So with that, we will capture those that have hepatitis B infection. And remember that the effect, lasting effect of hepatitis B is to have hepatoma, liver cancer, all right, or even liver cirrhosis. So cancer, and of course, once we talk about hepatoma, it is knock dimittis, entrepreneur otherwise, So these are the screening. Then the issue of cervical cancer, we're still screening again, to find out. We've talked about the issue of the age. Most authorities will say from age 21 for sexually active individuals should be able to check. Some authorities, WHO say age 25, so it depends on the authority. But to do a pap smear, we keep saying pap smear. In fact, sometimes even in hospitals, the ladies, have you done your pap smear? They have not, How will you know? HPV. In fact, right now, there's even a step forward. Apart from the pap smear, you can also do HPV screening, DNA, to know whether it's positive or negative, among others.
Okay.
Yeah.
Unyime, is there anything you want to add?
Okay.
Because I'll still come to you based on that peachy panel.
Yes. Yeah. You've actually mentioned a lot of it. We just would want to encourage people, like you said, know your status, go in for your screening. know, are you safe from gonorrhea, Hep B, chlamydia, the whole line. Or there are a lot of people that I know would come here and like, oh, that's a whole lot. I'm not showing symptoms. Yeah, you're not showing symptoms, but you might be a carrier. So it's safer to know, am I clean or am I dirty? Yeah. So go for your checks.
I actually like that. It's safer to know, am I clean or am I dirty? So where does a panel like SYNLAB Peachy come in, and who should consider it for a test?
Okay. Thank you very much. Toying doctor's line, I'll tell everybody of reproductive age. He said WHO said 25 and above.
No, he said 15 now.
15 to 49, yeah, okay.
But the active one,
sexually active one,
yes.
Because these days, with the Gen Zs we have, there's a whole lot happening. So, okay, we have the package in SYNLAB called the Peachy series. It starts from Peachy. We have the Peachy Plum, Peachy Plum Max, Peachy Plum Plus, Peachy Plum Extended, then the recently curated one, Peachy Premium. This package contains most of these STIs that doctor just mentioned. You have the herpes simplex 1 and 2, chlamydia, hepatitis, HIV, hepatitis B and C, then even the high vaginal swab to check for bacterial or fungal infection. So you could walk into a SYNLAB location, someone will be there to attend to you and walk you through the different packages to know which one suits you, and they're actually pocket friendly. You can't overestimate the advantage of knowing your status over, not knowing your status, then you now end up spending a whole lot of money treating.
Yes.
So it's better to know your status, prevent it, than just walking blindly, then you spend a lot treating.
Wow.
I want to say something.
Yes,
see,
please.
the screening is actually a way cheaper than treatment.
Yeah.
On a more serious note, because you can you can screen and there's nothing.
Yeah.
But if you don't know and you're already infected, you spend, doctors, you keep coming. And these things, most of the time, you see them coming back because an individual can be treated today. You go back to the same partner. That partner has not yet been treated.
Yeah.
You will get reinfected again. And when you have reinfection, that's not very good for any individual at all. Yeah. So treat a partner.
And treat yourself.
Absolutely.
And another thing that I just remembered, viral infections, I don't think there are treatments for it. Rather, it's being managed.
Absolutely.
Any viral infection, there's no treatment. The person could only be managed, to prolong their lifespan. So go check yourself today.
I'm with you on that. Go check yourself. Thank you very much for your contributions on this episode. Wow. This has really been eye-opening. Silent infections, that should make you sit up straight on a normal day when you know that you can be healthy and you're a silent carrier of some of these diseases. Yeah. Well, listeners, do not forget to subscribe, like, share, and follow SYNLAB Nigeria on YouTube and on Spotify. Stay put. We're just getting warmed up.